lot of you heard that that HRSA wanted to
The
do a
conference
national
is in
update.
lecture mode.
Wanted to do a national update of the scores for all the Auto-HPSAs. In the past, the scores were reviewed by request of the organization, and the system, there was no system to review the scores on a regular basis. And my understanding is several organizations haven't even had their scores reviewed in several years. And the national update provides HRSA with an opportunity to review scores on a more regular basis. How often that's going to occur, we don't know. We haven't been told that by HRSA. I guess they want to see how this first update goes before they make a commitment to how often they'll be doing this. Oops. Sorry. This project, the modernization project, began in 2014 when HRSA asked all the primary care offices to update the providers in their state. For some of the smaller states, although it was difficult, it's been more of a challenge for larger states like ours. The next phase of the project was a national update of all the HPSAs that were either population HPSAs or geographic HPSAs. Recently, we just did a national update on, we sent in applications for all the correctional facilities in the state, and now this is the next step, the Auto-HPSA update. Nothing has changed about the scoring criteria. As you'll see on the next slide, there are several criteria they use to ascertain your score. But again, I do want to emphasize that we do not know how often HRSA is planning on doing an update to look at the scores. As you can see from this slide, and some of you probably already know this, but your population to provider ratio is what is most heavily weighted towards your scores. In particular, for primary care and dental HPSAs, that ratio counts for twice for your score. So getting updated provider information is pretty critical to get an accurate score. So what our goal is to get accurate information so we can provide everyone with the most accurate scores possible. I know for some of you, you like the score the way it is and have some reluctance about updating provider information, but at our end, our goal is to make sure that the scores are based on accurate, timely information. And as I stated earlier, the primary care offices, which here in Pennsylvania is at the Department of Health, has been charged with updating that information. Right now, we're looking at a new process to update that information, and we've been working with the Department of State as well as labor and industry to use the relicensure process to update provider information. We did manage last year to update dental information, and that information has been downloaded into our application system, which is called, we call it SDMS, but that's short for Shortage Designation Management System. That way we've been able to update the majority of the dental providers in the state. Right now, we are in the process of doing a similar process with the primary care providers and psychiatrists in the state. Because of the timing of the national update, it's going to occur sometime either, right now they're targeting April, but it could be into the summer before they do the update. We're not sure that our data that we're collecting now is going to be available in time for the update. Once our new process is complete, we hope approximately 40,000 providers will be updated in the state using the licensure process. And since we've been charged with making sure that the provider information is up to date for this national update, we're actually asking for your assistance to help us collect this data. What we're in the process of doing right now are developing surveys for the individual organizations. We received the same list that each of you did, showing us what providers have impacted your score. We'll be using that as a basis for the development of the surveys. One thing, and I know it's puzzling to a lot of you, and we were puzzled by that as well, the providers on your list are based on providers that have been updated by our office up until this point. I know some of you think, well, why are only one kind of providers showing up on our list? Since the only providers we've updated en masse have been the dentist, for particularly in the urban areas where we haven't updated other providers, the dentists are the only ones showing up on your list. For the more rural areas, since there are fewer providers, we've been able to update psychiatrists and primary care providers. But for the urban areas, we really have not been able to update many of the psychiatrists or primary care providers. So since the dentists were the only ones updated in your area, that's the reason that's the only providers showing up on your list. When you're updating providers, assuming that you're willing to assist us, it is possible that you'll contact a provider that doesn't want to cooperate, that doesn't want to answer the questions. Don't force the issue. If you want to try calling them a couple of times, that's fine. At some point, we'll be able to collect that data, but for now, the attempt to contact someone outside your organization, if they don't want to cooperate, we can't make them and you can't make them. So if you contact somebody and they don't wish to respond, just make sure when you get the survey that you let us know that. Now, if you do have off the top of your head, if you know information about providers outside your organization, please feel free to just let us know if they've retired or if they've relocated or anything that you might know about them, particularly if it's someone, even if it's someone who's not on your list or on your survey, go ahead and add them into the survey. Also, we want, if someone in your organization that is not on the survey, please add them and give us the information we need for them as well. The more providers we update, the better. So we certainly want all the providers that work for you. This is what a survey is going to look like. We'll be sending out instructions on how to fill this out. But some of the most important information we're looking at is the MA, the medical assistance information, the sliding fee scale, how many hours a week they spend seeing patients, what their status is. Most of these are drop-down boxes. So, like for the MA information, if you click on it, there'll be a drop-down box, and you can just select the number that would be most appropriate for that provider. Okay. The deadline to complete your survey is going to be February 22nd. I know that sounds like a quick turnaround for some of you, but given that the update as of right now is scheduled for April, we need time to get that into our application system. Tony and I are pretty much the two people who will be doing that, so we'll need plenty of time to get that information into our system. In January, usually, HRSA locks the scores for the purposes of placing individuals from the National Health Service Corps into placement. So there should still be time after the national update that if you want to submit information that could help your score, there should be time to do that. Right now, the portal that HRSA is planning to develop that will allow us and you to submit additional documentation hasn't even been developed yet. And based on the information we're receiving from HRSA, that isn't going to happen until after the update. And again, this is just a reminder that since this population to provider ratio is a significant part of your score, it's going to be important for us to get accurate and up-to-date information. Okay. As I said, HRSA is going to develop a portal so we can submit supplemental information. We'll be responsible for assisting the rural health clinics with that piece. I believe, if I'm correct, the FQHCs and the lookalikes will be able to use the portal directly to submit that data. And certainly, if you have any questions about any supplemental information you wish to submit, feel free to contact us, and hopefully we can help you with that. Okay, any questions?
The conference is no longer in lecture mode.
Okay, so this is Judd. The lines are open for any questions. And I'm going to start, Belinda, I'm going to start off with one.
Sure.
Since they have the data, the same data that you're going to see, that you're going to send them, even though they don't have the survey, should they start collecting information right now, or should they wait till they get the survey you're developing?
That's assuming they know all the information, all the data that we need. If they're asking for things like how long, how many hours a week a provider is seeing patients, the percentage of medical assistance that is used by patients, or the sliding fee scale, they can do that. They might want to wait till they get the survey just so they'll know exactly what information it is that we need to collect.
Okay. And how soon do you expect to have those surveys out?
Since there's another webinar next week, Tony and I were actually talking about that a little while ago. We're going to try to get those surveys out shortly after the next webinar to give everybody a chance to understand what we're looking for.
Okay. Any questions from the audience? And by the way, if you've checked in, if you've called in after we started, if you could let me know you're here, that'd be really helpful.
This is Steve Castellano from La Trinidad Hispana. I jumped in late.
Okay, thank you.
I know that one question that came up is I know a lot of people are curious about the data that we get from Department of State. What we've been doing is we have a survey that comes up when someone wants to renew their license. There's a survey that pops up, and it's got various questions. In the past, it was used to get workforce information. In the past couple of years, we've added questions specific to HPSA designation data that allows us to get information like the locations where providers work, percent of MA, the percent of sliding fee scale, that kind of thing. So the addresses that we're getting from the Department of State actually come from the providers themselves, and we do make it specifically ask for their practice locations.
Okay. So when you're assigning somebody to an area, as you know, saying that they're practicing in a given area, Belinda, are you using, which address on the survey are you using? Their practice location?
Yes, that's specifically what we're asking for. We don't ask for their home address. We're only asking for all their practice location addresses.
Okay.
And one thing I really want to emphasize as well, depending on how often HRSA is going to do an update like this, once we have updated that provider information, it will be in the system and it will eventually impact your score. So I know for some of you, as I stated earlier, you have a little bit of reluctance to update that information because there's a possibility it could negatively impact your score. The thing is that provider information is going to be updated. It will either be impact your score now or when they do the next update. So I just want you to be aware of the fact that eventually that provider data is going to get updated.
Belinda, this is Judd again. My impression is a term I used with the committee this morning was that the scores are going to be more fluid than they have been in the past. And I don't know if they're going to just change all of a sudden, but the changes will come quicker and they won't be nearly as optional. They won't be optional at all.
That is my impression too, but we have not gotten official confirmation of that from HRSA.
Okay. All right.
All they're talking about right now is the one update, but I know their long-term ambitions for HPSA designations in general is for these updates to happen annually. They're not there yet in terms of the population and geographic HPSAs, but I know that that's a goal of theirs. So I'm going to assume that is going to be the same for your membership.
Okay.
Belinda, this is Raji from Community Health Clinic. How did you determine the sliding fee discounts made available by these providers, or do you have any recommendations on how we go about finding this information?
Well, that's a good question because in the past when we've used phone surveys, we've tried to nudge that information verbally by saying, do you have a sliding fee scale? And our experience has been if they don't know what that is, or if they say, well, we offer a discount, then probably they are not offering a sliding fee scale. For the relicensure, for the licensure process, we haven't really explained the sliding fee scale very much. And we're trying to decide whether in the future we want to continue trying to collect that information because quite honestly, unless somebody works at an FQHC or a lookalike, or if they're National Health Service Corps, they work at a rural health clinic, they probably don't offer one anyway. So if you're calling someone to get that information who's outside your organization, you might have to tease that information out of them a little bit. But if they're not sure, they probably don't have one.
Okay. So if they do not have one, will they remain on that list, or is there a partial score to that?
For the purposes of your score, it's not. They probably won't count, or if they do have MA but not a sliding fee scale, that'll impact the FTEs. We still need that information regardless.
Okay.
But in terms of your score, all they're going to look at, if they don't have a sliding fee scale, but they do see medical assistance patients, then they will count the FTEs towards what they're reporting as their MA patients.
Okay, thanks.
Any other questions?
Yes, this is Blake from Delaware Valley Community Health. So I understand like the medical information isn't out there yet, but does this mean that the dental scores are probably correct at this point then? And we should be comfortable moving forward with them since they have dental data?
The dental data was collected last year. It is possible that something could have changed. Let's say, for instance, you know of a dentist in your area that is on the list, but you know that they've retired. or that they've relocated, we would need to know that.
Okay.
Because that would be counter to what we updated last year.
And when you said last year, Belinda, you meant 2017, right?
Yes, that's true. It is 2019, but barely.
Right, barely.
So, yeah, in 2017 is when we updated that information. So it is possible. I think overall, dentists, based on my experience, the dental information doesn't change that much. But like I said, someone could have retired, someone could have relocated. Maybe they've decided to partially retire and reduce the number of hours they want to work. So if you're aware right away that some of that information is no longer correct, it would really be helpful for us to get that information.
Can I add one thing?
Yes, go ahead.
Even though the discussion's about dentists, this is Ed Noggle. Belinda mentioned this, but it's important to do that. For the providers in your own organization, even though they're not on that list that HRSA gave you, we would very much appreciate the information from all three disciplines for all your providers. In other words, dental, mental health, and primary care. So if you can provide us with that, that would be extremely helpful to us.
One other question that I'm kind of aware of that's been floating around out there, I know a lot of people are curious about the supplemental information like the fluoridation rates, things like that could change your score. Right now, there's no mechanism for us to submit that information for you until the portal comes up. And again, I don't know what the ETA is for that. HRSA just keeps saying it'll probably be after the national update.
Okay, that's helpful. Are there any other questions, folks? Okay, well, if you do have questions, there's the contact information. Belinda, do you want to wrap it up?
Sure. Like I said, if you have some questions, maybe you think of something after the webinar ends, feel free to call Tony or I, or you can just email us at that email address. It gets checked at least once a day, sometimes 2 or 3 times, so feel free to use the email address if you want. And like I said, some of you know me, so you know how to get in touch with me. And like I said, Tony is also available to answer questions in case I'm tied up. He can answer questions for you as well. But again, we really appreciate any help you can give us in updating this data. It's really important for the whole state to get this information and get accurate information. So we really appreciate any assistance that you can give us.
Okay. Thank you, everybody, for taking your time out today for this. And also, if you have any comments you want to share with me, you know how to get me, judd@pac.org. And thank you so much, and thanks, Belinda, and the whole staff at Department of Health. And we will
You're welcome.
talk to you later. Thank you.
Thanks.
Okay.